everyone, I'm Christy with Rise Pilates. Today I'm going to show you how to reduce some tension using a lacrosse ball, and I suggest doing this in seated. It's really great if you're in the office or you have a desk job and you can just keep this next to your desk. But you can also do this on the floor if you have pretty flexible hamstrings. So kind of like pick what works for you, but go ahead and grab your lacrosse ball and then join me in what position works for you. So first I'm gonna take the ball and I'm gonna lift up and I'm gonna kind of find my sits bone. So that kind of bone that you sit on in a chair. You wanna use the ball to find it. And then once you find it, you're just gonna ease onto it. And a warning, this could be pretty intense, especially if you have a lot of pelvic floor tension. So go really easy. If you have a chair with handles, it can be nice to kind of like support yourself a little bit. The other option, if this feels really intense, is put a blanket onto your chair first and then put the ball on top of it. And then you have a little bit of give. So right now I've kind of found the inside of my sits bone by rolling onto it. And then I'm going to continue to just sink into it. And you essentially want the ball to be touching your sits bone the whole time. It's like that close to it. So as I rest into it, I'm going to try to relax my leg. I'm going to try to relax my breathing a little bit. Take some tension out of the neck and the shoulders. Maybe close your eyes as you do this. But take some long, deep breaths. And on each of your exhales, see if you can just sink onto it a little bit more. So as kind of a warning, I don't want you to go beyond like a 3 or 4 on the pain scale. So if you feel like you're in a position where it just won't let go and it's really tense, use the blanket. Maybe find a different position where the ball is hanging out so it's not quite as intense. You want your nervous system and your breath to start to relax and that sensation to start to kind of dull. Your body will kind of be desensitized to it after a while. So I want you to take enough breath that you can get to that point where you're just like, whoo, okay, it's taking the edge off, right? Once you get to that point, we're gonna do a little bit of pelvic tilting. So this is gonna be really subtle, but I'm rocking my pubic bone up towards my nose a little bit, and my sits bones are kind of scooping underneath me. So the pressure of the ball is gonna go towards the tailbone just a little bit more. And then I'm gonna reverse that by pointing the tailbone or the pubic bone down. And then that ball rolls forward just a little bit. So kind of like towards my knee, if you will. And then again, it's really subtle. If you start to feel a lot of that sensation come back, maybe find a little rotation and then pause there and do your deep breathing again until that area gets desensitized. And then find a new position in a different rock and do the same thing. Wait until your nervous system and your body just relaxes into it a little bit. So I would suggest kind of finding a spot, waiting, finding another spot, waiting, and then you can start to gently rock forward and back a little smoother. And as I'm doing that, I'm trying to kind of gently put a little bit more weight towards that side of the pelvis. So I'm not super shifted, right? But I can like ease into it a little bit more, be a little more upright and neutral. And that's also gonna change the sensation. So for me, I'm like, whoa, that really like got into my tighter spot. So I'm gonna take a beat, rest into that position until my body kind of like gets used to it. And then that's a new position for you to rock the pelvis forward and back again. And now you're getting a little different muscle tissue that's getting a little myofascial release in there. So once you've done this a few times, I would say rock the pelvis about 10 times, find a new position, rock it about 10 times. And then you're gonna work with internal and external rotation of your leg. So step the opposite leg out a little bit. So the ball is in my right side, I'm stepping the ball is in the left side, I'm stepping the right leg out. I'm gonna lift the heel of my left foot. That already changes the sensation a little bit. And then allow the knee to drop to the outside of your body, and you might get less sensation. So your deep hip muscles that you're massaging, or those deep pelvic floor muscles, are shortening a little bit. And so when you come into this position, the ball's a little more likely to kind of rest up into that musculature. Then you're gonna bring the knee internal rotation. Go easy with this. Try not to use your muscles to do it, but use your hand to press instead. And you might feel that tension come back a little. You might feel some stretch around the glute. And that's because those muscles are tightening while you're pushing a ball into it a little bit. So use your hand, gently move into external rotation, and then gently move it back to internal rotation. And then once your body gets pretty familiar with this, then maybe come to parallel or neutral, and then just internally rotate, and then come back to neutral or parallel. And then a little internal rotation, and then come back a little bit. And just kind of stay in that range. And you might even get to a point where you hold the internal rotation, and you try to bring a little weight into it again and go back into your breathing. That can take a little while, or like a few days or weeks of repetition for your body to be okay in that position. So don't push it into this, just take your time with it. So once you've done that, again, probably 10 times is just like my magic number that I like to use. Then you're gonna really gently ease away from it. Take the ball out. Woo! And then come down, and you might even just feel your sits bone on the mat a little bit more. You have like some nice sensation going on back there. And I almost feel like lopsided, right? So it's kind of nice to just feel the difference from one side to the other, and then we'll switch it to the other side. So again, I'm gonna take the ball and I'm gonna ease onto it until I can find that sits bone. Once I've found it, I'm gonna slide over the top a little so it goes to the inside of that sits bone. So this one's a little tight for me to start with, so I'm gonna ease in pretty slowly. I'm using my tented fingers as a little support here. And then just start with your breath. So you're just gonna take a couple long breaths in and out. Inhale, you might feel a little of that tension increase. As you inhale, the pelvic floor lengthens and lowers. And then as you exhale, the pelvic floor naturally lifts a little bit, which is why it's a nice time to try to ease into it a little bit more. So the inhale is nice and big. Maybe try to breathe into your belly. That's gonna help relax your nervous system, stimulate like your vagus nerve, so your rest and digest nervous system response. And then keep easing in, and you'll feel that ball kind of tuck inside of the sits bone a little bit. And that's kind of what you're aiming for. You don't want it to slide too far to the middle. That might get kind of uncomfortable. I mean, this is all uncomfortable, but a little different, right? You want it to kind of tuck in there, which is where like those deep hip muscles are housed that get really tight. Okay, so once you're here, let's go into the rocking again. So I'm gonna tip my pubic bone towards the ceiling slightly. See if you can do it this time with some deep core activation. So that's an exhale, and kind of lift the belly button up a little bit to avoid clenching your butt cheeks together. And then you're gonna gently tilt the pubic bone down towards the floor, kind of coming upright, feeling the tailbone lifting just a little bit, but try to stay nice and heavy on the ball as you do it. So it's a really slow and gentle tilt. You're like gently tucking the tail under as the belly button comes in, and then opposite direction, pointing the pubic bone down, little lift of the tailbone, and just rock nice and easy. I'm going in a really small range of motion, but if you feel okay with it, you could really rock back here, right? And you could really tip the pelvis forward and feel the ball slide even further forward towards the kneecap. Just try to avoid kind of going over any like bony pieces here, right? Especially as you start to tip forward, then you'll start to run into some things. Okay, so find kind of a neutral position again once you've done about 10 of those. Open up the left leg if you're on the right side like me. Then lift the heel of the right leg. Use your hand to open up the knee. Feel that sensation change. Maybe take a second to sink into it again. And then slowly close the knee. And don't force it here. Just feel where you have like a little restriction. Maybe hold for a breath as your body gets used to it. And then gently let the knee open back up again. So use your hand pressing in just a little bit. I can feel that tightness all the way to the outside of my glute. So maybe you're like me and you feel that happening. And then rock it back out. And then do that just a couple more times. You can always pause and just do more at your own pace too. And like, you'll start to get used to not even needing me for this. And you can just gently do it on your own if you want to be self-sufficient in it. Okay. Let's bring the knee in. You're gonna hold it there. And again, you can see that my hip's kind of hiked, right? I'm gonna try to drop my hip again a little bit. See if I can do some breathing. And it's just a gentle release and back into it. It's almost like a really, really slow pulse here. And you might feel that you get just a little bit further, but not necessarily by pushing it further, just noticing, oh, my leg is willing to go a little bit further. Okay, I'm gonna lower the heel. Very gently, I'm gonna start to ease away. Take the ball out. Woo, and come back down. And maybe just kind of rock yourself from side to side. Feel the difference. It feels really nice for me. I feel like my whole nervous system is kind of relaxed a little bit. I really like to follow this up with a little narrow-kneed child's pose and some long diaphragmatic breathing to get some pelvic floor lengthening. Now that we have some sensation down there, now that you have some blood flow going on down there. So go ahead and come onto your knees. I'm bringing my knees together for this. And then I like doing that because it kind of restricts my belly as I come down to force the air to the back and then down towards the pelvis. If you have a big pillow or a bolster, then put that in front of you so you could just lay your head and kind of wrap your arms around it. I just don't have that right now. And in this position, notice if you feel kind of that like heat happening, right? You got that like little bit of inflammation and blood flow down there. And then take a really long breath in. See if you can feel the breath travel down towards your back, all the way through the tailbone, and all the way to the sits bones that you just were kind of working around. And as you exhale, just let yourself sink onto your legs, relax down onto the bolster or floor. And again, inhale and do it soft and long. If you can do a really soft 5-count inhale, you might be able to reach a little bit deeper into the pelvic bowl, allowing it to just passively and naturally stretch like it should as you inhale. And then exhale, you'll just feel that like little pelvic pressure go away and you'll just sink down a little bit more. And I want you to do about 10 breaths here. I'm going to do 2 more and then let you kind of complete those on your own. So a long breath in, really relaxing around the sits bones. See if you can feel a little bit of pressure increasing in the pelvic bowl. And then as you exhale, you're just going to feel that pressure go away, sink down a little bit more. And then do that one more with me. And a long exhale. And you're welcome to just stay in this position and finish out a few more breaths. All right, Good job, everybody. Thanks for joining me for a little pelvic floor lengthening and kind of getting it warmed up. This is really good if you get some pelvic pain around this area. A lot of times people with urinary stress incontinence, where you sneeze and get some leakage, it can actually be really common that you have some pelvic tension going on, and it's not just a weakness thing. Anyways, I hope you have a great day, and I'll see you next time. Bye.